Hi, I'm Dr. Ronjon Paul. I put this video together to help you understand how a lateral interbody fusion works. This video goes over the basics of how and why I do the procedure and what you might expect to undergo during surgery. The lateral interbody fusion is a specific procedure that allows me to access the spine through your flank or your side. It's done through special minimally invasive retractors, tubes, and dilators. In doing so, I avoid making incisions on the back and going through some of the muscles in the back. This is oftentimes an easier way for specific situations. Those situations include times when you may have had surgery in the past, or there's a scoliosis, or there's significant instability in certain planes that are creating pressure on the nerves. A lateral interbody fusion is an elegant way to access the spine and relieve some of those conditions while affording stability and better alignment to your back. A lateral interbody fusion is a minimally invasive procedure. We're able to access the spine by first putting you on your side, and then I bring in X-ray to minimize the size of those incisions. The incision is then utilized to apply a special tube and dilator and a minimally invasive retractor through the side of your back. When we access the spine, we can use retractors to minimize tissue disruption. We identify the bad discs and then remove those stepwise. In doing so, I can then release the spine and realign it by using special spacers that are put where the disc previously was. Those spacers have inside of them material that grows bone very readily. That restores bony alignment and stabilizes the spine. Throughout the surgery, I use advanced imaging and navigation technology to help optimize precision and implant placement. Careful attention is also paid to overall spinal alignment and balance. The goal of this is to improve long-term durability of your fusion and reduce stress on surrounding levels of the spine. After we're done with that procedure, some patients do need posterior surgery. That surgery is oftentimes less invasive because much of the work has already been done through the side. The thing to understand about spinal fusion is that it's not about just placing screws, rods, or other hardware. It's really about getting the bones to grow together and heal themselves. In doing so, that is actually what will relieve your pain. A lateral interbody fusion is just one way we accomplish lumbar fusions. It's not appropriate for everybody. We understand you may have more questions. Please feel free to contact my clinic at any time.